Hello. Today I'll begin my Pecha Kucha on schizophrenia. Despite being one of the most researched psychological disorders, we still have yet to fully understand schizophrenia. Throughout this PowerPoint, I will discuss the background of schizophrenia, its presentation in the clinic, the neuropathology, and its treatment. Schizophrenia infects one's mind with hallucinations and delusions, ultimately causing them to lose a grasp on reality. Biological risk factors were first introduced when German psychiatrist Emil Kraepelin described schizophrenia as a severe syndrome with organic origins. Genetic studies have indicated that a person with a family history of schizophrenia has a predisposition to develop the disease. And additionally, some studies indicate that social factors such as family environment could contribute to the development of schizophrenia. The three hallmark features of schizophrenia spectrum are as follows: hallucinations, delusions, and thought disorder. The DSM-5 states the requirements of the diagnosis of schizophrenia as the emergence of 2 or more symptoms during a continuous period no less than 1 month, along with indications or signs of schizophrenia lasting for at least 6 months. Symptoms of schizophrenia can be grouped into 3 categories: positive, negative, and cognitive. Though there is not a complete understanding of neurotransmitters in schizophrenia, there are some hypotheses. The two-factor dopamine hypothesis states that the excess dopamine in the mesolimbic pathway causes the positive symptoms of schizophrenia, while a deficit in dopamine from the VTA to the prefrontal cortex results in the negative and cognitive symptoms. On the other hand, the serotonin hypothesis suggests that the excess serotonin neurotransmission results in the positive symptoms of schizophrenia. This hypothesis arose from the study of hallucinogens such as LSD. Neuroimaging has provided evidence of structural abnormality in the brain. MRI scans of adolescents diagnosed with schizophrenia have detected loss in tissue of the brain, beginning from the parietal lobe and eventually spreading throughout the brain's entirety. Antipsychotics attempt to restore dopamine and serotonin levels in the brain and are commonly prescribed to those diagnosed with schizophrenia. First-generation antipsychotics are dopamine antagonists and reduce positive symptoms, though these antipsychotics also pose some side effects that can develop symptoms similar to that of Parkinson's disease. Second-generation antipsychotics are both dopamine and serotonin antagonists and reduce both positive and negative symptoms. Though these decrease the side effects from the first generation, the second-generation antipsychotics are also associated with weight gain. Additionally, token economy is a behavioral therapy in which individuals are given rewards upon the completion of desired behavior. This can be used to promote engagement in daily activities. The combination of pharmacotherapy and psychotherapy will yield the greatest therapeutic effect. Our understanding of schizophrenia is incomplete yet continues to evolve as we advance our studies of neurostructure and our development of antipsychotics regulating dopamine and serotonin.